What is mental health? Common approaches to mental health counseling. Podcast episode 2 by Alexandria Courtney, licensed mental health counseling associate. There are a few common therapeutic approaches to mental health. One includes cognitive behavioral therapy, which is a structured, goal oriented form of psychotherapy. It operates on the principle that your thoughts, feelings, and behaviors are all interconnected by teaching you to identify and challenge unhelpful or negative thought patterns. A therapist helps you modify your reactions and behaviors to cope better with life's challenges. Moreover, dialectical behavioral therapy, or DBT, is an emotional regulation form of psychotherapy that uses four pillars of, of behavioral growth, including mindfulness, which is the foundation of dialectical behavioral therapy, learning to be fully present in the moment and observe thoughts without judgment, tolerance, managing crisis and tolerating emotional pain without making a situation worse or resorting to impulsive actions. Emotional regulation, which is understanding, naming, and reducing vulnerability to intense or painful emotions. And interpersonal effectiveness, which is learning how to assert your needs, say no, and handle conflict while maintaining your self respect and relationships. Also, trauma informed therapy is another common approach to mental health counseling. It relies on safety, which is ensuring that you feel both physically and psychologically safe during sessions, trustworthiness and transparency, which is building trust through clear expectations and open communication, collaboration, which is treating you as an equal partner in the therapeutic process, empowerment, which is validating your strengths, choices, and resilience, choice, giving you control over your pace and direction of your treatment, as well as peer support, which is integrating shared experiences into recovery when appropriate. Also, solution focused brief therapy, which is a structured form of therapy spanning typically 4 to 6 sessions, sometimes only lasting a single session. Initially starts with session 1, where the therapist and client explore what the client wants to be different, establish measurable goals, and discuss current strengths. Subsequent sessions then focus on shifts to discussing recent successes and evaluating progress since the previous session, with the closing session being with the closing usually end with the therapist providing a summary of the client's progress, highlighting what went well, and offering small manageable actions or observations for the client to try before the next meeting. Also, cognitive processing therapy, or CPT, is delivered over about 12 weekly sessions. It teaches you to identify, challenge, and modify unhelpful, trauma related beliefs like self blame or feeling unsafe that prevent you from recovering. CPT addresses stuck points, cognitive errors, or rigid ways of thinking that stem from trauma. The treatment focuses heavily on 5 core areas of disrupted by traumatic experiences, which are safety, trust, power and control, esteem, and intimacy. Also, eye movement desensitization and reprocessing, or EMDR, is an evidence-based psychopathology designed to help people heal from trauma and PTSD. It uses guided rhythmic bilateral stimulation like side to side eye movement or physical tapping to help the brain safely reprocess distressing memories and reduce their emotional intensity. A course of treatment includes history taking, preparing coping strategies, assessing target memories, reprocessing them, and evaluating the results. A standard therapeutic session generally lasts between 60 to 90 minutes. And that is the end of podcast episode 2.